Most people move their bodies by using their muscles incorrectly, typically in an incorrect sequence.
Hey there, welcome to our podcast. Before we jump into today's episode, could you please do us a solid? If you're enjoying what you hear, give us a 5-star rating and hit that subscribe button on your platform. It really helps us reach more parents, coaches, and youth in the youth athlete development scene. All right, let's get into this week's chat.
Welcome back to the In Athlete podcast. I've got another special guest. I think all my guests are very special in their own unique way. And Carel is unlike anyone that I've actually worked with and known, especially in the BeActivated world and the injury rehab space specifically. And then today we're actually going to be talking about how BeActivated techniques and explore its application in managing and recovering from concussions. And now with concussions, for those that don't know too much about concussions, I'll link a previous episode into Alan Pierce, who's an expert in the concussion research world. And what we want to do is bring it more to a bit more of the application side and potentially how, a shutdown of the body can actually potentially result in a likelihood of a concussion. And Carel can actually touch upon that as well. But before we actually get into that, Carel, tell us a little bit about yourself, how long you've been doing activation for, and then kind of a bit of a quick background in terms of how you got into it.
Yeah, good morning, Trent. Thank you for having me. I'm a physiotherapist, originally from South Africa, and been living in Australia now for about 4.5 years here in Melbourne. And I was introduced to the BeActivated concept, I think about 15 years ago, where I just stumbled onto a course, and it had a radical impact on my own health. Firstly, I think that's where probably my interest in this work started. And then as I started implementing these principles with my clients in my practice, I started seeing much quicker and more repeatable results with clients than with the conventional approaches that I used before, and specifically with specific conditions. That got my interest, and over time I started using these principles more and more, seeing better results, and particularly being able to address the cause of problems more. And was fortunate enough to get to the point where I got to learn from the guy who started this work, a physiotherapist by the name of Douglas Hill in South Africa. And firstly attended a lot of his courses, and then was fortunate to end up in a position where I started working with Doug and started teaching with Doug, and to the point where today I co-present his courses all around the world. And I've been fortunate to be involved in this approach for a long time.
Yeah, can you just discuss the general concept of what BeActivated is about? So, the basic premise.
Sure. So, in short, BeActivated is a system where we look at faulty or compensation movement patterns. So we analyze movement essentially. We look at an athlete, and most people move their bodies by using their muscles incorrectly, and typically in an incorrect sequence. So what we find is that you'll find that some athletes will move their body by constantly overloading their upper body, and they will then break down with injuries in a predictable way. And other athletes again will have compensation movement patterns where they persistently overload their lower limbs, and they will end up with a lower limb type of injuries, and others. So with this system, we'll identify those compensation strategies, and then we'll use various manual techniques on the body by releasing restricted soft tissue and stimulating reflexes to get your brain to use your muscles in the correct sequence. And if we can correct that, then it has a very immediate impact on the way we move. It immediately gets our athletes moving more efficiently, which in effect makes them stronger, makes them faster, makes them perform better at their sport. And then the flip side to that is when they move more efficiently, then suddenly there's less overload, and it has a big impact on the injury risk. And I would say, in short, that's the concept of BeActivated. And it's really aimed at identifying and then addressing the root cause of these injuries from the start, and much earlier, I think, than we look normally in conventional approaches.
Yeah, because if you want to compare that to, I guess, or traditional like physiotherapy out of the university system, how does that compare to what BeActivated is?
I would say, unfortunately, a lot of conventional therapy approaches, and this doesn't just apply to physiotherapy, I think it applies to various fields, is that a lot of it is often quite symptomatic, in my opinion. We spend too much time working on the symptomatic area, and not enough time at actually addressing why this is happening to clients and what is the root and the underlying cause to why this client developed this specific injury. I always use the example of, you can have two athletes that do the same training, they do the same sport, they attend the same training sessions, the same strength and gym sessions, and the one ends up with recurrent ankle injuries and the other one ends up with recurrent lower back pain. And as a young physiotherapist, that always bothered me as to why is that? Is it just unlucky? Is it just purely our genetics that's predisposing us to certain injuries, or are there other factors at play? And I guess with the BeActivated approach, we're really able to zoom in on those other factors more. What is it that puts that athlete specifically at risk for these type of injuries? And then to actually address that cause from the start, not only at the end of their treatment, not only after we've treated them acutely and we've got the injury resolved, then we do a bit of rehab. That's more sort of the conventional approach, as I would say, where with BeActivated, look at that cause from the start. If we can address that cause from the start, we take away the overload early on, so even whilst they're recovering from the acute injury, that recovery is a lot quicker. And if we address the cause like that, then of course there's much less chance of this reoccurring in the future, which I think is the big thing, is making more of a long-term impact on these injuries.
Yeah, and then for professional athletes is more time on the field, more money.
Well, yeah, essentially, if we're looking at sports, those are the two factors. If we can improve performance on the one side, and at the same side we can limit injuries, and particularly long-term and recurrent injuries, then that's a winning recipe for success in sport, at any level.
Yeah, and I want to break it down into concussion. So, something felt. That's right. Concussion seems to be a big hot topic in Australia at the moment, especially with Australian rules football. NRL has actually seen a lot of players actually have to retire. They've been forced to retire now because the league is like, we cannot have you on the field. We cannot ensure you in terms of your long-term health. And, if you listen back onto our older episodes with Dr. Alan Pierce, he really does go into detail about that in terms of the long-term issues that can come from that as well. There's also the documentary that came out with Bennett Omalu, who was the founder of CTE. And then with concussion, obviously it's a traumatic brain injury affecting brain function. So any time that the brain is, impaired is a brain injury. And unfortunately with Australian culture, we don't treat a brain injury like we do as like a hamstring tear or an ACL tear. I've got my own beliefs in terms of ACL tears these days, which we'll talk about later on, is almost becoming like a fad. It's like it's like trendy to have an ACL tear these days, which
sadly it's become that common that it's almost trendy. Yes.
Yeah, it's like, you ever tell your ACL yet? What are you doing? But I want to talk more about concussions today. Obviously, you have to go get a diagnosis and making sure that if you do suffer a concussion from that side, go seek the appropriate medical help and slowly integrate physical activity over time as well. But I want to talk to you specifically about the potential mechanisms for concussion as well. And it doesn't seem to be spoken about. It's like, yes, it is a hard hit to, a traumatic blow to the head, or it might be some sort of whiplash effect, falling to the ground. But can you explain a concussion from a BeActivated lens?
Yeah, look, just touching on what you said, Trent, I think there's been a huge move in the world of sport to be a lot more aware of the high risks of concussion. I mean, we're pulling players off the field if there's any potential chance of a concussion. We're testing them and then only sending them back onto the field once they've cleared certain tests. We keep athletes off the field for much longer to be careful. I think there's been a lot of work done to be preventative and to really care for these athletes in that sense. But where I think a lot of problems comes in is that we're not addressing the actual risk that individual athletes have for concussion versus, other athletes. There's certain athletes that will have recurrent concussions. And again, the question for me arises that why is it? They play the same contact sport. Why is it that the one guy ends up with concussions, 2 in a season, 3 in a season, and others don't? And it's more than just faulty technique or being unlucky to take certain hits. I think there's certain physiology involved that puts athletes at risk for concussions. Now, if we look at it through the BeActivated lens, as you say, is what we do with this work is we assess faulty movement patterns. So it's got to do with, without getting technical around it, but it's got to do with how we initiate movement in the body. In other words, what initiates or starts any movement that we do? So if we start running, how do we initiate that movement? Now, if we do it correctly, movement should be initiated with the muscles around your pelvis, your glutes, and muscles like your psoas, your main hip flexors are the muscles that should be initiating movement correctly. So if everything goes well, those muscles initiates movement for us. But for various reasons, people develop compensation strategies where they initiate their movement somewhere else in the body. So some athletes will initiate their movement by tensing the muscles in their jaw and in their neck and in their shoulder region initially. So they start their movement by first always tensing in the upper body. Now, those clients are typically at risk for concussion injuries. And the way that works is they will use their jaw and their neck muscles to start movement. So those muscles will always contract and tense first. They form various connections to the fascia network and form long slings with other muscle groups in order to move us almost with a chain of muscles, if you like. But the movement starts in the upper body. Now, if that happens, it means the jaw and the neck muscles are always occupied. So any movement they do, those muscles are always tensed or contracted. And if that's the case, then those muscles are unable to perform their normal or their design function. So their design function of the neck muscles is to obviously control the neck, is to provide stability to the neck. Now, if we take that to a concussion environment, if that client who has an upper body pattern, and these patterns we call 3-3-3 jaw patterns or 3-3-3 arm patterns without getting technical, but it means movement gets initiated up there all the time. Now, those guys, when they go into a contact situation, they don't have the same stability and control in the neck than someone else will have that is running a different pattern. And when those athletes then take impact onto their head or a whiplash type of situation onto the ground, there's less support in the neck, and therefore there's more velocity, there's more impact on the actual head and eventually then on the brain because of that lack of stability and control. So clients with those patterns will be more at risk for concussion type of injuries. And I've seen it in my practice over the years. Those clients that specifically come in with a history of recurrent concussions, those clients, if you test them, almost always have these upper body movement patterns, which then suggests that the movement pattern puts us at risk for those injuries. Now, it doesn't mean an athlete with different patterns can't get a concussion. They can, and if there's enough circumstances that come together, of course that can happen. But the client that has the compensation strategy where they use their upper body all the time, that client will be more at risk with lesser impact to get a concussion injury. And that is what I believe we're lacking in addressing with these injuries, and also why we see reoccurrence of those injuries so often.
Yeah, because we always look at or like after the fact, but also preventative measures of getting the neck generally stronger, these structures specifically. But eventually there'll be these jaw drivers. Eventually there'll be a yielding point where they won't be able to do their role specifically, no matter how big the neck may be. Yeah. Even though if you look at a sport like rugby, the bodies are just getting bigger. They've actually tried to mitigate and reduce forces as well. Obviously with the scrums now. So there are changes to the game to, I guess, de-escalate the forces going through the body. But then again, we're still getting concussions.
I think you're touching on a really important thing where we're doing so the concept of, yes, we need to strengthen their necks and get them stronger. We understand the concept, and that all makes sense. And I think that is definitely the aim. I think the problem comes in is if someone if they have a compensation strategy, what we're doing then is now we're strengthening the neck, we're strengthening the shoulder region, but the strengthening on its own doesn't change the compensation pattern. So we then make them stronger by using all sorts of accessory muscles to strengthen up around the neck, but we're not changing their general movement pattern in their body. And that unfortunately doesn't solve the whole problem. So sometimes we're successful and we can actually bulk up the other muscles all around the neck sufficiently that they get less at risk for concussions. But if we're not also addressing the movement pattern, then we're actually still sending them out on the field with the same compensation strategy. And I believe that's the reason why that conventional type of rehab often fails and they still get reoccurrence. Now, it's not to say that the strengthening and the rehab doesn't have value. Of course, it has value, but what I'm trying to explain is that there's something else that we need to do in between. We need to apply certain principles first to change their movement pattern. And then once we've changed their movement pattern and we're maintaining a better movement pattern, then we apply the rehab and the strengthening principles. And if we do it like that, then I believe we get a lot more success with protecting these athletes when we send them out on the field again. Okay.
So obviously you've worked with individuals that have suffered concussions and multiple concussions, and you've tested their pattern and they've come up as a jaw driver. Are they normally, depending on the side of how they sustain the concussion, is there any difference if they are in BeActivated world, if they're a bilateral jaw driver? Is there, or if they're a jaw driver on one side and arm driver on the other side, are they more likely to sustain a concussion on one side or the other? Hopefully that question makes sense.
I'm not sure, but I think what you're asking is if they've got, so if we can explain maybe to the listeners, if we look at movement patterns, we look at how someone initiates their hip movement. And some clients can have the same pattern on both hips. In other words, they move their right hip and their left hip by initiating that movement in the neck and in the jaw region. Or sometimes you have clients that have different patterns where they will initiate the hip movement on the right, for instance, in their neck and their jaw, and they'll initiate the hip movement on the left, potentially in their lower leg. Now, I guess what you're asking is if we see a difference in the reoccurrence with that. I can't say that there's a difference in the type of injury we necessarily see if someone has only got a jaw pattern on the one side versus someone that has a jaw pattern on both sides. But I definitely think there's a risk in the sense of someone who has what we call a bilateral jaw pattern, or in other words, they use the same jaw pattern for both hips. They are weaker in their control on their neck, and they are typically more at risk for a concussion than someone that would only have a jaw pattern on the one side. I believe they will have an increased risk, but that risk will even be more than that if they have bilateral pattern. So in my experience, the guys that I've seen over the years that typically have recurrent concussions are almost always bilateral jaw patterns. And the interesting thing is, I mean, they may be big, strong rugby players, footy players, AFL players, and if you have a look at them, they're physically strong. Some of these guys have necks that are broader than my torso. But if you test them on actual flexion control on their neck, so we do a test with that where we just do a simple strength test of their ability to control flexion. Very, very often they have less than a 10 kilogram force ability that they can withstand on neck flexion. But then we're sending them out onto a rugby field and going into a scrum situation where you need, in my opinion, you need 30 kilograms of plus at least to withstand those type of forces. So it's interesting that even with bulk muscle strength, they often don't have that flexion control, and it's because they're driving these compensation patterns.
Yeah, it's just I just find it fascinating, especially if you work like with real big, muscular dudes. It's just like it doesn't matter what you do to get their neck stronger, they're still running the same pattern. It's like you've still got the I guess a good analogy is like you still got the wound bleeding, but there's nothing clotting it specifically. You're just covering it up with more bandages. Hopefully the whole thing will hold, and eventually at some point it will just yield and it'll just kind of the floodgates will open again.
And I think that analogy that you're using there is very good. And I think that's unfortunately often what we do with these injuries, but also with many other injuries, is that the rehab, all the components that we provide sometimes is just, as you explained, an extra layer of bandages. But we're not actually fixing the problem. We're giving them more ability to compensate. We're strengthening all of their compensation strategies. And if we can do that well enough, sometimes that is enough to seemingly overcome the injury. But with those clients, we still often haven't addressed the actual root cause. And if we were to do that along with the rehab, then the results are just much better. And that's really what we're doing with this work. And yeah, sorry, go ahead.
Sure. And how would you go about helping someone get to the root cause? What do you do in your practice to actually help someone?
The interesting thing is that to address the cause is often seemingly working on things that is not directly related to the area of the injury. So if someone would come in with recurrent concussions, what I would do in my practice, we would test their movement patterns. We'd get an understanding of how they're compensating. For me to know how to work with them, but also really important for the athletes. There's massive value in just understanding, why is it that I keep getting these concussions? Is it just that I'm unlucky? Is it that I'm not spending enough time in the gym? For an athlete to just understand, well, they've got a movement fault that is actually putting them at risk. And it's not because of the lack of their effort that they keep getting injured. It's because it can't be resolved by just pure strengthening and training. So getting them to understand the pattern, I think, is essential. Now, to change someone's movement pattern is really about getting them to move more correctly around their pelvis, around their hip region. So what we do with this work is we go and remove, by physically working on the body, restricted soft tissue that limits their brain in using the muscles around their hips correctly. So we remove restricted tissue that stops them, for instance, in using the hip flexor and using their glutes efficiently to initiate their movement. Now, the amazing thing about the nervous system is once you take that restriction away, our brain has got this amazing ability of adjusting almost instantly. And as soon as that restriction is not there, the limitation is not there, your brain goes back to its default, if you like. And it will revert to using those muscles for the function that they were designed to do. Now, with the BeActivated system, that's essentially what we do. We get movement correct around the pelvis first. And a very important part that we haven't touched on is we get their breathing correct first as well. So without getting into details, but if we're moving incorrectly, there's normally a big component of also breathing incorrectly. So guys who overuse their neck in order to drive their movement and then become at risk for concussions, they often also breathe in their upper body. So they will use a breathing pattern where they breathe on the upper part of their chests. So correcting movement, correcting breathing to be correct from the pelvis area is the first thing we would do. And then we will go through a systematic process for correcting the big muscle groups, firstly, all the way through their legs. Then we look at the muscle groups that starts affecting sideways and and the transitional muscle groups into the upper body. And eventually only we will correct the actual area around the shoulders and the neck. But if we do it like that, then we've built this foundation of how the body is moving correctly, firstly in its core, then through the legs, then into the upper body. And then if we correct it like that, then we can get to actually a sustainable state where someone can move more correctly moving forward. Very important part of that process is then also to educate our clients, firstly to understand their pattern, but then to leave them with tools in order to maintain a better movement pattern going forward, so that they don't need to see me every week for the rest of their days in order to move correctly. That's really important. And then it comes into what you guys do, Trent. I mean, once we have the movement pattern corrected, then of course the strengthening and the gym work and the rehab that's required is still important. But then it's actually you getting to rehab and move them and strengthen them in the correct pattern. And I think that is essential to having long-term success with concussions, but also with many other injuries.
Yeah, then for the athletes that you've worked with in the past that have suffered a concussion, how do they start to implement it on their daily in their daily lives? Like, how would you suggest? Like, is it before training, when they wake up, before they go to bed? How do we keep them in that that solid pattern, that good pattern, more often than not?
Yeah, so I think the first thing that the last thing you said there, I think is important more often than not. So I guess we're not aiming to get someone to move perfectly all the time, because there's many factors that makes our body shut down and will make us revert to moving with compensation strategies. What we're aiming for is to get someone to move more correctly more often. And if the more often we can get them to move in a correct pattern, the less at risk they would be for injury. So how do we do that? Once I've done some work with a client, we get them and get their body into a state where they're moving more correctly. We teach them certain strategies to maintain it. And the strategies are really around preparing the body for movement. So we'll teach them certain releases that they will do on their own body, and that will allow for them to move more correctly around the pelvis. And if they can maintain correct movement around the pelvis, then your body doesn't have the need to find another compensation to do that. So by maintaining that correct control around the pelvis, by maintaining correct breathing and using your diaphragm, your body then doesn't have to go search for compensation strategies. So we'll teach them a routine that they make part of what they do at the start of every day, and particularly for athletes as part of their warm-up every time before they train. And if they can then assure that their body's moving and breathing correctly before they start training, then suddenly the training session becomes a lot more effective, and they end up then strengthening their muscles in the correct manner. The sad thing is, and that's what I always tell athletes as a motivation, all the hours they put into training, all the commitment they put into training, it's pretty sad if you then end up training, but not training your muscles in the correct way. It's a bit wasteful. So if you're going to be putting in all that time, it's worthwhile to take an extra 5 or 10 minutes to prepare your body for that training, get your muscles firing in the correct sequence, then train. And then suddenly the results that's yielded by our rehab, by our training, by our strength work in the gym is suddenly a lot more. And explaining it like that to athletes, I find gets their attention, because it's a massive commitment that these guys put in. And if they understand there's simple things you can do that makes that commitment suddenly yield more results, then they're normally pretty happy to do that.
Yeah, I've noticed that it also reinforces good movement patterns as well. So they start to feel the difference. So like some of our swimmers, they'll feel the difference in the pool and move more efficiently. If we're just talking from just a general scope of activation. And then also it actually quickly improves their technique as well, or improves their technique a lot faster. It's able to stick a lot better as well moving forward. Yeah,
and that's another. I find that often when I work with coaches and I work with teams, then there's often it's almost like what's the word? There's something that goes missing between the coach and the athlete. The coach is training our athlete on his, let's say, swimming technique. and showing them, teaching them various things to do to correct their swimming technique. But because the athlete's body is programmed to move in this faulty way, they can't get it right. Their muscles doesn't have the ability, whilst they're moving in a faulty movement pattern, to swim with that perfect technique in the pool, for instance. So as soon as we get that athlete moving more efficiently, then they're suddenly able to apply what the coach is teaching them. And then you suddenly see that then technique improve, because they need to have the physical ability to apply that. And if their movement is faulty, they often don't. So I think that's an important concept that you touched on, which is maybe a bit outside of the topic, but an interesting thing to consider.
Yeah. So where can they find you? How can someone get a hold of you? Maybe we've got coaches on here as well that want to learn more. I know we do those seminars online as well that are around the world. How can people, if they want to know more about BeActivated techniques or even work with you, how can they find out?
Look, from an individual point of view, I work with athletes or clients at my clinic in Hawthorne, and they're welcome to have a look online for my website, and also for my presence on social media on Instagram, where I post regular teaching and information on this topic. Trent, I'm happy for you to share any of my contact details if there's any coaches out there who would like to have a chat about this and about how the BeActivated concept can be implemented with their teams in order to improve performance and reduce injuries. More than happy to meet up with them and have a conversation around that. I do training workshops with teams and groups as well on request. And I think maybe something just to mention that BeActivated is not something that we only use with sport. This is for anyone that's moving in a way that's causing overload on the body. And it's not only for sporting injuries, it is for people that get tension in their body because of just everyday life. And often for the same reason as for an athlete, it's linked to our compensation strategies.
Yeah, and that's what I've spoken to a lot of our members about here as well. It's just like, well, we have like a guitarist, or he plays in a garage band. Imagine if we just got him breathing better, his ability to sing and project completely changes. But that's another topic for another day, though.
There's something I thought maybe just to mention before we finish this one up is for those listeners out there, if you have the movement patterns that puts us at risk for concussion, doesn't only end up in concussion injuries. The guys who have those patterns are often athletes that suffer with certain things. So they end up being those athletes that always have tension or tight shoulders. They end up being athletes that commonly have neck pain or stiff neck. They are athletes that commonly have jaw issues. So people that clench and grind. Clients that often suffer with recurrent headaches. Those are all very typical symptoms that athletes have when they have what we call a 3-3-3 jaw or neck pattern. Now, those will be the symptoms you would more likely see, but they would also be the type of athletes that are typically at risk for concussions. Those symptoms are normally what we see with us. So for those of you that may be having regular symptoms like that, maybe haven't had concussion injuries yet, if we are able to identify those patterns and do something about correcting those patterns, then we can be very preventative. And I think that's a really important thing that also links in with what you guys do so well at the Inner Athlete, is about looking at what can we do to prepare our young athletes so that we can prevent these injuries actually before they're happening. And that's probably even the more important role that we can play than just helping the guys that have already been hurt, is how can we prevent these type of injuries and have less concussions moving forward, not just manage them better.
Cool. Thanks for that. That was really good. If you like this episode, please share, like, subscribe, follow us on whatever platform you are listening to. And Carel, we'll see you on the next one.
Fantastic. Thank you.
You have just listened to the Inner Athlete podcast. Be sure to subscribe to stay up to date with the release of weekly episodes. Be sure to follow us on Facebook and Instagram to get great tips on all things youth athlete development and youth mentoring.